Good morning, everyone. This is Dr. Armstrong, and I appreciate you all being here today. We are continuing to discuss a very important topic, which is suicide prevention. It is both sensitive and incredibly important. Today, we're going to talk about how you can help in the preventing of suicide. We want to take a look at a few statistics. A few statistics here. Statistics. Every year, hundreds of thousands of people worldwide they take their own lives. Suicide is among the leading causes of death in the United States. One of the leading causes of death is suicide in the United States of America. Each suicide has a ripple effect that deeply affects families, friends, and communities. Now, the myths and the facts about suicide are this. The myth is that people who talk about suicide won't actually do it. That's a myth. And the fact is that most people who die by suicide have communicated their intent in some way. Verbal expressions such as, I can't go on, I just want to end it all, nobody will miss me, that is an indicator. Behaviors such as giving away possessions, withdrawing from social interactions, even researching the methods, that is an indication. A person's mood, and this is something that we really have to take account of, is their mood. Despair, hopelessness, increasing irritability, uncontrolled anger. That's an indicator. Now, risk factors when it comes to suicide. I want to give you a little overview of the statistics of suicide, okay? Previous suicide attempts is one of the strongest indicators of a future risk. Then there are the mental health conditions, especially when it comes to depression, bipolarism, and certain personality disorders. Substance abuse is known to increase the impulsiveness and decrease the inhibitions. Access to lethal methods such as firearms or certain medications. People often tend to overdose when it comes to suicide. The feelings of hopelessness, isolation, and unbearable pain. Okay. All of these are risk factors. What are the protective factors? This is something that we need to look at. The protective factors when it comes to suicide. Effective mental health care is number one. Positive connections to family, friends, and community. Problem solving and conflict resolution skills. The religious or cultural beliefs that discourage suicide. Okay? So let's look at how you can help. How you can help. You know, you're very important in this whole role, in this whole scheme. If you just listen to someone without judgment and show that you care, ask direct questions. Are you thinking about suicide? Stay with the person. If they're in immediate danger and unsure, they should not be left alone. And of course, you want to get the professional help. These are some of the ways you can help, okay? Contact a therapist, psychiatrist, or a helpline. The suicide line is 988. 988, okay? Local therapy and counseling centers often provide free mental health services, support groups. Churches sometimes provide support groups, and this is well needed. Okay. I want to give you a little clinical overview as well of suicide, the prevalence and the epidemiology of this. Globally, suicide remains a significant public health concern. It is contributing to a significant percentage of all-cause mortality. Now, within the United States recently, data indicates a steady increase in the suicide rate, particularly within certain demographic groups. Okay? Comprehending the phenomena of this, it can take a biopsychosocial model or scale, if you want to say so. Suicidal behavior and ideation can be understood through a biopsychosocial lens. Biological factors such as neurotransmitter imbalances, psychological factors like maladaptive cognitions, and social elements like isolation collectively contribute to suicide risk. Okay? Then, from another clinical standpoint, is the cognitive triad. The cognitive triad. Individuals at risk may demonstrate Beck's cognitive triad. Okay, Beck's cognitive triad, which are negative views about about themselves, the world, and the future. Okay, how you can help is to recognize the warning signs. Recognize the warning signs. Once again, the verbal indicators. They are either explicit, such as "I want to die," or implicit, "things would be better without me." Expressions like these are what we call expressions of suicidal intent. Then we want to look at the behavioral markers, such as self-harming behaviors, psychomotor agitation, or increased substance use might be a signal of increased risk. Emotional indicators, such as prolonged dysphoria, anhedonia, or affective flattening, can be suggestive of an escalated risk. All right? And I'll tell you more about anhedonia in a few. Risk factors and protective mechanisms, the diathesis stress model. Some individuals have an inherent vulnerability, such that which is diathesis, that when coupled with life stressors, heightens suicidal risk. Okay? When the life stressors just become too much. All right? And then we have the interpersonal theory of suicide. Now, listen, this theory persists that the convergence of three factors, thwarted belongingness, perceived burdensomeness, and acquired capability, can result in suicidal behavior. Okay? Let's look at the protective factors when it comes to this, the clinical part of it, right? We need to have an effective therapeutic alliance and community integration, as well as robust coping mechanisms can serve as barriers against suicidal ideations. Okay? There are evidence-based clinical interventions. Okay? And one of the best interventions, and it's a model that I use in my practice, is dialectical behavioral therapy, known as DBT. It originates from cognitive behavioral therapy techniques. DBT emphasizes skills in emotion regulation, distress tolerance, and interpersonal effectiveness. It has demonstrated an efficacy in reducing self-harm, and especially in people with borderline personality disorders. Okay. DBT is great because it brings you in, it grounds you in, it makes you aware. Okay. Safety planning, a collaborative dynamic intervention, that helps clients identify and commit to specific steps that they'll take when experiencing suicidal thoughts. And I talked before about cognitive restructuring, okay? And then there are what we have means restrictions, clinically guiding individuals and their families to reduce access to lethal means, which can drastically decrease impulsive suicide attempts. Okay. And then we want to look at the pharmacological consideration, SSRIs and antidepressants, or even we want to look at the herbal part of this. There are natural, holistic means, okay? While medications like selective serotonin reuptake inhibitors can be beneficial and crucial to monitor any shifts in your mood, it's always good to have the talk therapy. It's always good to have the talk therapy. So I'm making a call to action. I'm sending that call out, folks. It's a call to action. Effective suicide prevention requires a collaborative effort across multiple sectors: mental health professionals, community leaders, and families alike. We need to continue to educate all demographics in our society about suicide prevention. That suicide does not have to be the end. And this is what I want people to understand. It doesn't have to be the end. If you're listening to this, there's a better day coming for you. You need to have the hope within. There is a better day coming for you. Do not feel that the situation that you're in right now is it. If you put forth a little effort, I can guarantee you that your outcome and your circumstances and your situations, they can change. Take it from a therapist. I have gone through the process of reinventing myself a couple times, and sometimes we have to do that to find out who we are. Okay? Take the time, folks, to be self-aware, know who you are, and while doing so, know that suicide does not have to be your end. There is hope. There is a light at the end of the tunnel. For those who ascribe to anything spiritual, take the time out and pray. Stay in prayer that your situation can change. Put forth a little effort. You know, I come from a old spiritual family background where my grandparents, my grandmother, of course, was a very spiritual woman. And she always said the old adage, if you make one step, God will make two. I believe in that. Make the first step to improving and bettering your situation. All right. Thank you, folks. Listen, 988 is the national suicide number. Okay. It's preventable. Understand that. It is preventable. Thank you for listening today, folks. Hope you all have a great day. Take care.